I'm Dr. Prema. I'm a OBGYN board certified, and I already trained in OBGYN residency back in India. And I had the great opportunity to train here at Yale to do my internship and also to do my fellowship in Cleveland Clinic. And also I'm fellowship trained in urogynecology. That's my great interest, to treat women with urinary incontinence. I moved to California in 2003. I've been practicing here almost for 7 years in Pasadena, Arcadia, and Temple City area. So I'm in private practice, and I always wanted to be in private practice. Actually, I'm board certified in India in '95. I practiced there for some time. I came over here and redid all my training and also my fellowship. Now here in Pasadena, last 7 years, I'm doing my private practice. I worked in different hospitals back in India too. So my whole training and practice is almost now 20 years. Actually, from my young age, I wanted to work with women and children. So the doctor's job, especially choosing OBGYN, gives me a good opportunity to be with women and part of their care during their pregnancy. And I take care of most of the gynecology problems, and especially menopause and prolapse and women in urinary incontinence. So I love my job, and it comes from my heart. Actually, I'm an OBGYN, though I'm in fellowship trained in urinary incontinence. I take care of all the low risk, high risk pregnant women, and also common gynecology problems and the urinary incontinence. So I work all 5 days a week. 2 days are my OR days, and 3 days I'm in the office full time. And my thing is to treat each patient with the individual personalized care, so they deserve the time they want. I give them time to ask me questions, to understand what is their the problem they are going through, and also give them options, and all my patients know what is their issues and what are the options to choose the treatment, and to be partner of care rather than I don't force them anything on them. So I let them choose the treatment they want to go through. So they are very happy with that. Actually, in this whole Pasadena, Arcadia area, I may be the only female OBGYN who does more of incontinence practice, and also I'm a fellowship trained. And most of the primary care doctors in this area are my friends. I meet them every time, in the dining room and other places, and all my primary care doctors, I'm sending them a newsletter every month just to make them understand how important it is to evaluate the incontinence when the patient talk to them. And also they get the feedback about the patients. We work as a team, and if the elderly patients, we get a medical clearance, and so most of the PCPs are very happy with the communication we have and also the treatment that patients get it. And so that makes our practice unique, and we work as a team with the PCPs. And also the patients are very comfortable when their primary care doctor is involved in their whole care. Actually, and also with the incontinence itself, our patients, when they walk in, we give them a detailed, after the initial history and evaluation, we give them a questionnaire to take home to answer and bring it back. And my office has a setup to evaluate by urodynamics. It's one of the computer-based tests, and I have it in the office. And after the test is done, and I discuss with them what the problems we see, and we diagnose the problem more accurately. immediately. And also to choose non-surgical treatments, we do it in the office itself. It's called a biofeedback, and it's exercising bladder muscles. So they are happy to come here, the same staff and the doctor. They treat different options, and everything we do it in office. So that makes they don't have to go to different places, and each time they come in, like we explain to them what we are doing, and we monitor their progress, like how they improve in their symptoms. A lot of them, they are happy with the exercise, and it helps them like 85 to 90%, and they can wait for the surgery for a couple of years, or sometimes just the exercise machine itself teaches them how to do it at home too. So we are unique in doing, and that differentiates from other doctors. Actually, incontinence is a very common problem, so there were millions of women in US is suffering. The ages can be from 30 to 80, and a lot of women think it's part of aging, or like it's not to be discussed in public. They're embarrassed. It affects their social life, but now we are making them more aware it's a medical problem, and they are more comfortable in talking to a woman doctor. And our whole team is trained to do this, so they are very happy about it. Actually, the treatment for incontinence by surgical procedure is very simple, and I think it's less than 15 minutes surgery, outpatients. Patient go home with no catheter. The incision is less than an inch, like 2.2 to 3 centimeter. So they heal within 2 to 3 days, and if I do the surgery on Friday, Monday they can be back to work. And it is working good. The results are very good, excellent. So we never fail because we kind of diagnosed more accurately by doing all the clinical and urodynamic evaluations. So in our practice, the results I can say like almost 100%, because we don't rush surgery. So we choose everything, and a lot of patients, the surgery is the last option. It's not the first option. The surgery is very simple, and actually the benefits of the surgery is way more than the pain and the discomfort they go through. It's very small, and also the patients before and after is their social life and a quality of life is, they cannot say in words. They kind of hug me and send me flowers and send me cards, and they think anything is deserving to be dry and comfortable, So it is a big medical problem ignored by just learn to live with that. So we teach them, hey, you don't have to learn to live with that. You can live and with a good quality, so like a dry bladder. I train my staff very well. I think not just the physician itself, the whole team has to work with good communication. The good practice has to have a good communication. So my patients can call me anytime. They can approach me, and my staff will know the importance of phone call. They listen to them, and they take messages based on the priority. And also each patient is treated individually, like based on their belief, and they basically get a personalized care. And we respect their privacy. We respect their every input they give it to us. And also since I'm doing the whole range of women care, starting from a teenager to a 86-year-old woman, starting with birth control to menopause and incontinence and prolapse, and I think like once the patient comes, they bring their whole family to me. I have so many friends here, so I enjoy doing that. I enjoy women care. I think like in my practice, I'm here for last 7 years. I do surgeries 15 to 20 a month, and never a complication, never a disappointed patient. And it is an achievement because each patient, when I think I'm doing a surgery, I think like it's the greatest trust my patients put on me. I respect their feelings. And I always work with what is best for that particular patient. So that's why, like, I always think I never had my patients go to with complications or any kind of complaints, or they come back after the surgery. So every single patient I treat with great care, and also to evaluation, and if I have to reschedule or I have to talk to them multiple times, I do that. So that's one of the things I'm so proud, that no complications with the number of surgeries I've been doing so far. And also the pregnancies, all the women are happy. I'm there for the delivery, and I never miss deliveries. And my policy is to anticipate and treat the patients, rather than most of the time, like, I can analyze, like, diagnose with my medical knowledge to prevent problems rather than dealing with problems. So that makes me successful in doing it. So I pay attention to every little thing.